Summit Estate specializes in the treatment of individuals suffering from a dual diagnosis. Whether in our exclusive residential or outpatient treatment facility, each individual receives holistic treatment to care for the mind, body, and spirit. Keep watching to find out more. What's dual diagnosis? When an individual who's suffering from a drug or alcohol addiction also has a mental health problem, such as depression or anxiety, it's referred to as a dual diagnosis, or a co-occurring disorder. Because of difficulties presented to providers who don't have experience with dual diagnoses, this disorder should be identified specifically by an experienced dual diagnosis treatment center. Which comes first? Unfortunately, there's no definitive answer to the question of which came first, the addiction or the mental health condition. The answer varies from person to person. For some people, they begin drinking or using drugs to cope with mental health conditions. In some cases, this is an attempt to self-medicate, while in other cases, their doctor prescribed the medication to them. However, as they continued using the medication or alcohol, they began to develop a tolerance to it. As a result, they needed more of the substance to get the same result. Once they developed a tolerance, their use quickly spiraled into an addiction. Alternatively, a person may have started drinking or using drugs recreationally. However, as their use increased, they began to develop a mental health condition. Dual diagnosis treatment. Unlike other treatment programs, a dual diagnosis treatment program offers simultaneous treatment of both conditions. On the whole, you may not understand why this is necessary. However, consider this situation. You've been using drugs to manage your anxiety, and you've decided to put your addiction in the past. You go through the detox process and are able to overcome the withdrawal symptoms. However, you now face an unexpected situation. Your anxiety symptoms have come back uninhibited by the drugs. Without the skills you'd learn in a dual diagnosis treatment program, you don't know how to manage these symptoms. Sadly, this leads you to relapse. Treatment methods. Dual diagnosis treatment gives you the highest possible chance for recovery. We address both conditions concurrently to give you the tools you need to manage your mental health condition in the future while also controlling your triggers and cravings for substance abuse. We use a wide range of therapy options to help you achieve this goal. Some options will be evidence-based. In other words, experts in addiction treatment have studied these options extensively, so we know they work. Other options may be holistic, meaning we address the harm addiction has done to your mind, body, and soul. Your therapy options may include cognitive behavioral therapy, dialectical behavior therapy, group therapy, and more. Integrated treatment. A dual diagnosis treatment program in California is quite different from substance abuse treatment alone. Both disorders are treated at the same time, known as integrated treatment, for co-occurring disorders. Integrated holistic treatment for co-occurring disorders is typically longer, goes through more crises, and progresses in a more gradual way. The individual being treated is also going to undergo more severe and regular medical, emotional, and social problems as they progress. At Summit Estate Recovery Center, we offer extensive treatment options for dual diagnosis, mental health, and addiction. With the help of our dual diagnosis treatment program, you can move into the future with confidence as you learn how to manage both conditions. To learn more about options for your treatment, contact Summit Estate Recovery Center today at 800-701-6997 or use our convenient online form. Thanks for watching, and if you found this video helpful, be sure to like, comment, and subscribe.